All right. So hello, I'm Philip Dowdell, and I've been studying the health domain. So this session, we'll be talking about how polarization specifically relates to public health and the effect of that relationship. In it, I'll focus first on its indirect health consequences, especially how it affects our perception of health issues and consequences of that perception, along with other indirect health effects. And after that, I'll move on to the direct health consequences of how polarization is specifically affecting America right now. So to start first, I'd like to define a term for you. This term is motivated reasoning. And this is when a person uses emotionally biased reasoning to produce justifications or make decisions that are most desired to them, rather than those that accurately reflect the evidence. Essentially, motivated reasoning results in biased decisions. Why this is important? When political messaging divides sides on a health issue, it increases the likelihood of the public interpreting the issue through their own political identity. This results in motivated reasoning and people picking sides on health issues, leading to more biased thinking, people believing in misinformation, and more people behaving in an unhealthy manner. As to how this affects us, there's plenty of examples of this, but perhaps none as immediately relevant as from the COVID-19 pandemic. It became a political issue very quickly, and as expected, this led to substantial issues. From a survey taken in April of last year, we see there were already significant differences in actions between Democrats and Republicans, with Democrats over 17% more likely to wear a mask, 13% more likely to avoid public spaces and crowds, and 13% more likely to cancel travel. Republicans were also significantly more likely to spread COVID-related misinformation, such as the virus being a malicious attack from the Chinese Communist Party, or that hydroxychloroquine was something that could be used to treat the disease. And this is not limited to COVID-19. On any health issue that becomes politically divided, such as this, people will be more likely to listen to their biases over facts. And another such example is vaccine exemption rates. This graph is particularly interesting, so to take a good look at it here. It shows rates of personal belief vaccine exemptions over time based on the general political beliefs of the given area in percentage. So, for example, in 2015, the percentage of students who were exempted from vaccines for personal reasons in neighborhoods that were greater than 70% Republican was just over 6%. The interesting things to note here is that the gap has been widening over time, indicating that polarization and the effects of it on health are increasing. And additionally, the more polarized area, the greater than 70% Republican neighborhood, had significantly more exemptions than even the greater than 50% Republican neighborhood, indicating that reducing polarization, even some, will have significant positive effects on health outcomes. However, this isn't the only way polarization can indirectly affect public health. The difficulty for political sides to work together, even when a majority of Americans agree, is another effect of polarization. Here's an example. A majority of Americans are in favor of a single-payer healthcare system, which would have numerous positive benefits on health, giving healthcare to more Americans, especially impoverished ones who currently have the least access to it. However, despite this fair amount of public agreement, there have not been policy effects, partially due to animosity between political sides, this polarization. And what's the result of this? At least partially, that we can see. This graph shows life expectancy versus health expenditure per person in developed countries. We can see that the US has a significantly lower life expectancy than most other developed countries, despite spending more money on healthcare per person. There are many different reasons for this, but one of them is being the lack of single-payer healthcare, which harms the worst off in our country the most. Now, moving on to direct health effects of polarization. These consequences aren't limited to bias and gridlock, but have more direct consequences as well. For one example, it increases stress. From 2016 to 2018, people are 15% more likely to describe talking about politics with those they disagree with as stressful and frustrating, the total percent being, let's see, I forget offhand, but it's over 50%. And as to racial polarization, this increased racial bias leads to increased stress and anxiety when dealing with those of another race, even in a non-threatening context. And it even hurts Thanksgiving dinner. Families that were likely to have voted for different presidential candidates spent about 30 to 50 fewer minutes together. To go on, nearly 6 out of 10 adults report that the current social divisiveness causes them stress, and this seems to be going up as concern about the future of nation, stressing people out, has been going up from 2019 to 2020. And this is bad. Too much stress is physically harmful, contributing to high blood pressure, obesity, diabetes, and heart disease. So what can we take away from this? Polarization results in motivated reasoning or biased thinking and political gridlock. This results in poorly informed health decisions, increased misinformation. Additionally, polarization directly harms us by creating a more stressful environment, which has many harmful health impacts. So, something that's important for you to consider as this trial progresses is that whichever plan best reduces polarization will have significant health benefits to the US. Thank you.
Thank you. Again, because this presentation has general applicability to both the pro position and the con position, there will not be separate questioning from the teams. However, there will be separate closing statements. So for the pro team, Mr. Andrew Bremner will come on screen and make a statement on behalf of the pro team.
Yes, thank you. So as we're looking at the effects of polarization on public health, we can see that polarization goes far beyond disagreement. It goes far beyond just holding different political values. It goes beyond the functional polarization that is essential for democracy. And that it's really causing chaos in the US. It's harming Americans in a wide range of ways that we don't think of when political and racial polarization comes to mind. You know, it's affecting our health and it's affecting our Thanksgiving dinners. It's not just COVID, it's not just vaccines, but any issue that is politically charged. And as polarization increases, more and more issues are becoming politically charged. Think about the current political climate and how much of a minefield it can feel like trying to navigate conversations with people of different opinions. And so as we're seeing that it's affecting public health, it's affecting physical and mental health, it's affecting Americans' well-being, that's not a cost that we can bear, okay? We must take action to prevent that, and we must take bold action. As we can see, it's affecting all Americans in everyday ways, so that is a hard problem to eradicate without really taking strong action that will engage all Americans like a mandatory program will, which is why in order to improve Americans' health and their well-being, we should implement this mandatory program to engage all Americans and try to reduce polarization, to try and tackle the causes of these harmful health effects. Thank you.
Thank you, Mr. Bremner. Mr. Satpathy will come on screen now and deliver a statement on behalf of the Con legal team. Mr. Satpathy.
So thank you, Philip, for your presentation. I think it showed us all how polarization impacts not only society in terms of how society perceives people, but also how polarization impacts one's health. It is important to understand that mental health constitutes a very important part of it, and different communities in the United States don't have equal access to healthcare. As we can see, in terms of the way people perceive vaccine rollouts, it would be counterproductive if, for example, the vaccines were made mandatory for people to take. There would automatically be a pushback for people to take the vaccinations. Hence, we believe that our program in the as part of the con-side advocating for the voluntary program, especially when we advocate for providing very safe spaces for interactions, which would aid in providing a strong mental space for people to interact, and we provide correspondingly with mental health resources for people to interact with one another. Secondly, our incentives also have focus on providing healthcare insurance benefits for people to take part, and those benefits would increase as people would take part in it. And so we combine the best of both worlds. We provide people with the choice, and hence they're able to willingly take part in it and not face the issue of trying to fulfill a mandate. But we also provide correspondingly the opportunity to have access to healthcare insurance benefits, which will mitigate the expensive cost of healthcare. Thank you.
Thank you, Mr. Satpathy. I've been reminded that we'll take just a couple of seconds here between each session because we're stopping